the more informed people are about how to make better use of technology and data, the better position we will be to react to things, so to epidemics, etc. And I've really seen that evolve for that to be the case in the past 10 years. 10 years ago, and no one really cared about data. It's such a niche field. But now, not even just within public health, but just in society in general, a lot of people are extremely excited about joining the data field and advancing work there.
Hey friends, welcome to Public Health Careers. I'm Marion, founder of the Public Health Millennial and host of Public Health Careers. Join us as we dive deep into public health topics and career journeys. You'll hear diverse career stories, absorb professional development and career strategies to help you learn, navigate, and transform your public health journey. On today's episode, we have Harold Gil. Harold is Principal Consultant at Informatics Innovation, where they're working to improve lives by developing the people and systems necessary to effectively leverage digital information and technology. Over the past decade, he has led groups towards the development of much-needed data analysis tools and products. Harold's goal is to improve people's lives using information and analytics, or by training others to do the same. He conferred a Bachelor of Science in Chemistry, Biochemistry, and Molecular Biology at the University of Miami and a Master of Science in Public Health at the University of Miami Miller School of Medicine. In today's episode, you'll hear and learn more about how public health informatics focuses on identifying who is sick, what they are sick with, and where they are in order to provide the right help and prevent further illness, how the lack of strong data analysis and technology skills is a major challenge in public health informatics and in the public health workforce, why data skills are valuable in any career and give you a competitive edge, why cross-sector public-private partnerships are beneficial for addressing public health informatics challenges, why building relationships, mentorships, and networking are crucial for professional development, and much, much more. Be sure to hit that subscribe button and share this with a friend. Enjoy today's episode.
Hey, this is Harold Gil. I'm a technology consultant and educator, and you are listening to Public Health Careers.
Harold, welcome to the show. I am excited to hear a lot about your expertise. I tried to get you in for one of the panels I was hosting, but I'm equally excited to have you on now to just learn more about your journey and hear more about your experiences.
Thank you for having me.
It is my pleasure. So jumping into things, how do you identify and tell us a little about your personal background?
Yeah, I identify as Hispanic male, he, him, his. My background, so my parents were born and raised in Peru, and they immigrated here as adults. And I was born and raised in Miami, Florida. And that's where I went to school. And currently I live in Indianapolis, and I'm an independent consultant. And I focus on implementing and teaching technology in public health. And my free time, I do combat sports.
What combat sports?
American boxing, Muay Thai, and Jiu-Jitsu.
And how do you get into that?
It started through a Groupon deal in San Diego, and I really enjoyed it. And I've been waiting for years for a nearby one to open up in Indianapolis. So when it happened, like 5 minutes away, I was like, God, send me this thing finally. And so I go like religiously 4 times a week, and yeah, I really enjoy it. It's a great way to decompress, and it teaches you a lot about your body, and yeah, you learn more about discipline and all that, but really about your body and how to control things. And so I really enjoy it.
Yeah, I've had a roommate who did a lot of Muay Thai and stuff like that. And he would just talk about the mind aspect in it and just how like focused you have to be, especially when people know the technique and things. It's just like really a mental game. But that's awesome. I've done karate when I was like 12, but outside of that, I haven't done much anything else. So that's cool.
I tried to get into karate when I was younger, but I couldn't get past the first few lessons. I felt like I really needed more contact, and so that's what jiu-jitsu offers me. So yeah, maybe you want to try it out sometime. It's really cool, and you definitely you learn a lot from being able to like hold off 200-pound people off you to just like to stay alive. So yes, highly recommend.
Yeah, that sounds like a good skill set to have in the back. Awesome.
For sure.
Now getting into more of like your professional work and experience. You have a lot of expertise in public health informatics. So I just wanted to kind of ground the conversation around public health informatics. So would you be able to just explain what that means to us?
Yeah, so in public health informatics, we find out who's sick, what they're sick with, and where they are. And we try to share that information with the right people so that we can figure out how to help them get better. And in general, we try to prevent people from getting sick using information systems.
That was a really good definition, firstly. So I appreciate that because I think anyone could kind of just understand that. So digging deeper into public health informatics, what are some of the biggest challenges that you're seeing in the work today?
Yeah, I think the biggest challenge is lack of strong data analysis and technology skills. And during the COVID-19 pandemic, the workforce and really the entire country kind of learned that these public health information systems aren't able to keep up with the demand. And so we now have that as a priority. The country, CDC, health departments across the country are now focused in improving these things through the Data Modernization Initiative, which is kind of like a national initiative, uh, really not just in public health, but across all sectors of government. And yeah, they're trying to just make better use of technology so that it can meet our needs.
And in your position in the consulting that you do, how do you support maybe public health departments and other organizations in overcoming some of these challenges?
Yeah, so I've worked for 10 years in public health government, and that has really been about teaching, for me, like one of my interests has been in teaching data analytics skills and how to make better use of technology, and I've learned along the way as well. And really, from the start, I've seen that as a workforce development sort of issue. And the more informed people are about how to make better use of technology and data, the more the better position we will be to react to things, so to epidemics, etc. And I've really seen that evolve to for that to be the case in the past 10 years. 10 years ago, and no one really cared about data. It's such a niche field, but now not even just within public health, but just in society in general, a lot of people are extremely um, excited about joining the data field and advancing work there.
And to that point, maybe someone is listening to this and they might have some interest in data skills. How, since you teach people in data analytics, what would be like the first steps you would tell them in getting familiar to build expertise?
Yeah, I would first figure out if they have any experience with programming. If they don't, I would say that's something to pick up and I'll put into a resource. So why programming is important is because it teaches you how to think in a certain way. These, technology and these computers ultimately uh, they think in a certain way, and so you have to be able to think in those terms with that computational model in mind. And so programming is a great way to do that. It when you learn how to program, you start learning about like logic conditions, like if then, for iterating, just thinking in those terms, mapping things. And so I think that is one of the reasons why it's such a priority now to help more people become data and digitally literate across the country. And so as a resource for people to begin learning, I would probably point them to the R for Data Science book, second edition. It's quite popular and it's free online. If you just literally Google the letters R for DS, short for R for Data Science, then you'll be able to find that resource. And yeah, you can download the materials, and pretty much everything is free through that. The data sets, R itself is free, and you can start to learn how to work with data. And I think this is something I promoted, years ago, that the knowing more data skills is going to help you no matter what you're working in. So I've told public health students in the past when I've come in um, to just promote what we're doing, career sort of things. And I've told them, whatever you end up working in, whether it's like leadership or unrelated to public health, knowing your organization is going to rely on the information, which is one of the most valuable resources the organization has, information about clients generally. And so you're going to, the more you can think in those terms, understand what's possible, why things aren't working, understanding your information systems are not going to be perfect, and how to work around that. That's going to give you a competitive edge, in my opinion, in whatever sort of field you or career you end up going into.
Well, thank you for sharing that, and definitely awesome to hear that R is still one of the leading resources that people can go to learn about data analytics, and it's awesome that that is the resources available for free. I'll be sure to put that in the show notes for anyone that is interested in checking it out, or you could just Google it yourself. But I think it's so important, and the data analytics, as you said, it is not only in public health, but it is a skill set that can be used across sectors, and in my opinion, it's one of the most valuable skill sets that you can have in public health as you're building your career. So just think about how you can learn data analytic skills, whether that's at a beginner level or at a more expert level.
Yeah, and I would say, just if the point wasn't made, that a few things that have happened recently in public health to to elevate informatics and data science have been like these four things. In the past 2 years, CDC created a data scientist job class, and other state, territorial, tribal, local health departments have done that as well. CSTE has added data science as a competency for epidemiologists as a core competency. The CDC Foundation has the Workforce Acceleration Initiative. They're placing, I believe, at least right now, I think it's 100, but in the past it's been even more, about 100 technologists, people that are skilled in data analytics across different health agencies. And CST recently has a senior public health data strategy fellowship that they just announced a couple of weeks ago that they're taking applications for it now.
Awesome. Well, I appreciate you sharing that and sharing like the relevance of it in like tangible ways that people can really move forward. So one last question before we get more into what public health means to you and your career journey is, what has been the benefit of cross-sector public-private partnerships to address some of the public health informatics challenges we face today?
Yeah, I think it's about cross-fertilization of ideas, of sharing ideas from one group of people to another. So, folks that are in the technology sector being able to bring their insights and expertise to government, because everyone said for my entire career that government lags the private sector and industry. And so being able to bring, here's some of the technology that would help you for these certain issues. These things have been available for years. This is not really experimental. This is being used by very mature organizations, and this is something that we can adopt. Likewise, only public health people really know their needs the best. And so them being able to share what their needs are potentially with industry, because then they can promote the sorts of products that they need. So right now, I mentioned how the public health information systems that exist weren't able to cope with the demand during the COVID pandemic. Why is that? The technology has, Facebook or LinkedIn, whatever these big sites are doing, they handle millions of requests, right? Billions even potentially a day. And so to not be able to handle hundreds of thousands of hits a day, that's not because technology is not present. It's because we just haven't set things up the right way. And so there's a lot we can learn from each other, and that work is currently underway.
Yeah, thank you for sharing that. And I think you were alluding to earlier the public health infrastructure grant and the data modernization
Right.
part in that. And I think like that is a huge part of like how do we build the infrastructure for data and data modernization and data sharing across public health so that we can be best able to attack the next issues that come about.
Right.
So what does public health mean to you?
To me, it's about setting up the infrastructure that's needed for people to live a good life, really. And that basic thing, that's basically my whole foundation.
Quick break. Come join the public health community with a 7-day free trial. You'll get access to learn, navigate, and transform your public health career through mentorship, coaching calls, resume, cover letter, and LinkedIn workshops, exclusive videos from yours truly, and much, much more. If you've been looking for career support, mentorship, or want to build your brand, look no further. Join the public health community today for a 7-day free trial at thephmillennial.com/join or from the link below. Let's build a stronger public health community together. Now, back to the show. Love it. And you got your bachelor's in science in chemistry, biochemistry, and molecular biology at the University of Miami. Walk us through that thought process going into undergrad.
Yeah, so I was drawn to all the sciences, and in college, in college I was interested in math, physics, biology, chemistry, and all the basic sciences. And those majors were the ones that were easiest and at the same time were like most interesting and at the right level. If you get any, into like the tiny subatomic particle, then it's like kind of hard to relate that to people and the human body. But I think with chemistry and biochemistry at that microscopic level, that was really interesting to me just to understand better, how medicines work or anything like that. That's kind of what drove me into that direction.
I don't think I've ever heard anyone say easy along the lines with chemistry, biochemistry, and molecular biology. But
Easier.
easier. Fair enough. Fair enough. And what kinds of experiences did you take on during undergrad? Were there any like internships or lab experiences that were kind of like pivotal or helpful for you?
Yeah, I had good mentors working at the chemistry lab, just in term, honestly, it wasn't even as much developing chemistry skills as much as just having my first really great mentor, Dr. Prabhakar, Rajiv Prabhakar in Miami. And so he was very encouraging. He was just a great mentor overall. And it was just great teachers who helped me how to think critically and even if something's published, not to necessarily just believe whatever is published because there's so many contradictory things. And so that required honestly years of of learning that skill. It's actually quite hard. After you pick it up, you only start realizing how complicated it is. And I did have the experience of joining an Engineers Without Borders expedition to Peru, to a rural village in Peru. And that's where I sort of first learned about public health. I so I went there. In my mind, I was just like, "Oh, it's a free trip to Peru! Yay, I'm gonna go." But actually, we were there to set up a drip irrigation system. And what I learned from talking to people there was, how they felt ill, and they work in these fields that are, far from their homes. This is up in the rural mountains, and the only water they can, they can really drink is the water that's running through their fields, and they have to use insecticide and fertilizer in those fields, so they're drinking water that has that. And they also don't, there's not really any like nearby bathrooms for like this huge expanse of fields, so that's really where they have to go. And so hearing about all that, I just learned, I realized, and just visiting the nearby areas, talking to people, it just became clear that those people weren't really going to get better from medicines. They were going to get better from the infrastructure being improved. And so I was talking with a friend about that, who happened to be who I think he was doing a PhD. He was doing a master's in international studies and I studied public health. And he told me, that's what public health is about. And I was like, what's public health? And that's when he told me. And when I found out about that, I started studying. I took courses in global health policy and started learning about WHO and how international health regulations and how all that stuff works. It was extremely interesting, and so I decided to further pursue studies and go to grad school and study for a master's in science of public health.
And before thinking about public health, before being on this Engineers Without Borders trip to Peru, what did you think the next like step in your career pathway would have been?
Yeah, I was planning to go the medical route and from like young. And so it just made sense. I think that's one of the things you hear about the most. I don't think I ever heard, like I said, literally never heard the term public health in my life up until there I'm in college, at the end of
Hmm.
college. And so, I think we tend to think like, well, how can I do something that is rewarding and that, helps people and just helps people. And so one of the things you hear about is just, medicine, right? Going becoming a doctor, going to medicine. But once I heard about public health and realizing that, these areas that don't receive as much attention, that's really the infrastructure is the core needs. That's what drove me into public health.
Yeah, and I could imagine the impact of having conversations with people in a community and just hearing about the challenges and the needs that they have and seeing the
Yeah.
reality that they're facing and how that could inspire you and like get I think to your point, like I had no idea what public health was, but an experience like that would really show me like, while medicine is helpful, it's not something that can help this population or like there are other ways to address health at a population lens. So that's cool. And did you have any other bachelor's takeaways that you wanted to share?
No, not particularly.
That's absolutely fine. And you went on to pursue a Master's of Science in Public Health at the University of Miami Miller School of Medicine. So, in your head, you were in Peru, you learned about public health, then you started taking some classes, learning more about public health. When or what was that decision for you to decide to pursue a master's degree? And then did you have to think through the process of Masters of Science in Public Health versus the Masters of Public Health? And how do you come to the decision to do the Masters of Science in Public Health?
Yeah, so when I was taking the global health policy courses, I had heard about the master's program. Other students were planning to do it. And I think between the MPH and SPH, I don't think you really have to necessarily decide until you're in it. And so I don't think I fully decided towards, the beginning of that. But I think I was sort of focused on that already because the MSPH offered a thesis option and I really wanted to focus on something and have something tangible at the end. So in my case, the MSPH thesis, which was I ended up getting published a year or two later after graduating, and that was about. So during I mentioned I was into like math, physics, and all that stuff, and so I joined. There was a vector-borne disease expert, and I think he used to even work for WHO or NIH, and he he was a really good mentor, and I since he was a mentor and you look up to these people, you kind of want to follow in their footsteps a lot of the times because they're such great leaders. I was in his team and I was following taking that route, and the work that he was doing, there was a he collaborated a lot with the mathematics department, and because they did disease modeling. So all this that you're hearing now about like, COVID modeling or monkeypox modeling, etc. They were doing that for a specific disease called Rift Valley fever. And I saw like, hey, I have like some math skills. I met with some people from the mathematics department, specifically one Dr. Chris Karsner, a mathematician, and I took some papers, so disease modeling papers, not ones he had written, but just some, just to get a sense. I was trying to see if I could do this stuff. And so I tried to read these and make sure that I understood them. And I explained these to him, and he was kind enough to honestly volunteer his time. And he said, "Yeah, you're right. This is what it's saying." And it was really interesting to me. And so, blended both my strong interest in math and public health. And so that was what I focused on for my thesis was Rift Valley fever modeling in Egypt, and yeah, that was just a kind of example of what I had learned from college of just like it's not like someone had told me the dictator like these are the steps you need to do to get experience in modeling and all that, or this is why this is important. It's just I found that interesting, and I myself reached out to people to like the mathematician Dr. Chris Kosner, who's a really modest man, and he helped me, and kind of just making your own way. I think that's kind of a theme. You have to just be resourceful, I think, and I think that sort of trait is extremely helpful in pretty much anything that you do.
That's very insightful, and I could imagine how helpful that was for you in like solidifying the expertise as well as like just building the keys for doing this work, and I guess also getting first-hand experience into modeling work before it was like popular, quote unquote, which I think is also helpful.
There was also it also gave me experience that specific project gave me experience and so it was a mathematical modeling, but also in doing more with computers. And so I learned how to work with MATLAB and Mathematica. These are tools that a lot of like engineers use and mathematicians. But I learned how to, if assuming one gave you a model at this point, then how to put it into the system so that you can play with the parameters. If this happened, if the mosquitoes came at the same time as the herd of cows or whatever, what how do the numbers change and all that, the river levels and all this, so that being able to play with that and yeah, just interact with these tools and technologies. That's kind of my first sort of experience in informatics in a way.
Yeah, that's really cool, and I feel like many of us don't pursue those type of opportunities, and now maybe because we don't know about it, or the opportunity isn't just provided, but it is so valuable to really be able to build out those skill sets, and to that point, just like do something because it's interesting, learn more about the modeling stuff, then getting deeper into the public health informatics, and just really like building more of what you want to do in public health and with that
Yeah.
skill set.
Yeah, I find that a lot of people are, and a lot of professors are very willing to help you. If you bring them something pretty specific, that's something they can provide support with, your students, and they're there to support students. A lot of people are really willing to do that.
Especially if you're specific and like you reflect and think about it, and ask yourself like, is this also the professor that would be aligned in doing this work? But yeah, definitely they are there to help and support you, so definitely reach out and see if there are ways that you can do projects or get published and things like that. And while you were in your master's program, also thank you for sharing the perspective of wanting to get the masters of science compared to like the just the masters of public health, and wanting to do the thesis. And to that point, that all that expertise that we just and the experience that you gained from the last like 10 minutes of conversation has been kind of, I guess, what has been beneficial in you doing that you're able to gain this tangible experience in that as well. So while you were also in your master's program, you were a student intern at the CDC. So do you want
Yeah.
to tell us about that experience?
Yeah, so I had the opportunity to go to Guatemala, the CDC Global AIDS program station there. And when I got there, I was assigned. That was cool also because, I'm Spanish speaking and, I got to go to Guatemala. And I was, like I mentioned, I was interested in global health at first. And and so that was a great opportunity. I was assigned some data sets for HIV AIDS patients and mortality and other things. And I was told to analyze them and just give a very straightforward task. And so I diligently went ahead and started doing that, uploaded it into my R. And I noticed very quickly that a lot of values, like half of the values approximately for many of the important fields, variables, were missing. And I was like, wait, what? This is like for an important report, like I think looking 5 years back and like half the data is getting missing. Like, are the confidence intervals going to be like this big? Like, how's this going to work? And I realized that this must be happening all the time and it must be happening everywhere. And that was just a realization, just sitting there before that. I'm realizing, it's not like this. It's not like this is the first time it's happened. This must happen everywhere, and this has clear implications for decision makers. And you don't have the information, the best information that you need. A lot of it's missing, so you're going to make suboptimal decisions, and so it has a huge impact. And that's when I just think this whole like train of like thoughts came to me, and at the same, so I'm thinking that's sitting with me, and then soon after, within a week or two, they asked me if I could confirm that their translation, their Spanish to English translation for a report is accurate. And so I'm reading this report in Spanish. And it said, I think there were like five of the seven countries in the report where basically, they were surveyed on what their most important needs are. And I believe it was like five of the seven countries in Central America. Um, that's an approximation. I may be off on the number of countries, but the majority of the countries that had reported said that informatics is their top priority, their top need. And so of course, I'm thinking like, what am I going to do, right? Public health is immense. Um, and so I'm wondering what is going to be my specialty. And I had just seen the term informatics somewhere, and I'm thinking about all this, and I'm like, okay, well, all these, I obviously want to focus where like I mentioned, I have a lot of skill where I can do a lot, but also where there's the greatest need. And so, and that way having the greatest impact. And so that's how I decided to go into informatics. Just to apply I mentioned my technical skills for something that a lot of countries are saying is their top need. And that's what got me into informatics, and that's what kind of got me into looking into more of that in the more opportunities in that field. And so, yeah, that was the Guatemala experience. I can mention what happened when I came back.
Yeah, please do.
So when I got back from Guatemala, I I knew that my previous infectious disease epi teacher was very involved in informatics. He was actually the lead developer. He was actually the CDC lead developer for EpiInfo. You've heard of EpiInfo?
Yep.
Okay.
Yep.
Um, so that was, I think it was the 90s it first came out. But he was the lead person for it. So EpiInfo 1, like he was the guy. And And so he was my priest teacher again. So I reached out to him and I said, "Hey, I'd like to do, like an informatics course with you of some kind." There's not, again, this 10 years ago, there's nothing, informatics data science is not popular. And I, I said, I want to do, something with informatics. Could we do like a independent, I forget what the term is, independent study? And he said, yeah, he agreed to it. And we went through the approval process to get it approved as a legitimate course, and it was just one-on-one, and it was a great experience. Looking back, I didn't take as much advantage of it as I should have, but it was still, I still learned a lot there. And so what he introduced me to was a lot of the web technologies like HTML, CSS, and JavaScript. And my project there, he had a website called openepi.com, which is still live. And he was trying to move some of that to the cloud. And so to Amazon specifically. And so that was my project. And a little bit after the course ended, I figured out this one like last detail that we needed, and I let him know about that. So that was helpful. And it was about a private API key. At this point, I didn't know anything about API keys. Now they're very common in tech. But that, yeah, it basically, I was able to store things onto the Amazon Web Services, from using like a little page. Like you put this file here, you click the button, okay, now it's an Amazon Web Services, and I can download it now. And so that was my first, um, yeah, experience with this web stuff, which is, just that alone is really helpful. And yeah, I learned a lot through that, and yeah, and he was one of the people that I reached out to help recommend me to the AFIF program later.
That's amazing, and I can imagine how formative that must have been. Learning about more of this informatics work in Guatemala, and then coming back and having this opportunity to work with this real like expert who has been doing this work, has led a lot of cool work while you're also building more technical skills as well.
One of the reasons I said that I didn't take as much advantage of it as I should have was because, we would just chat about things sometimes. And he was telling me that I remember when he told me that his son worked at Google, and he told me, yeah, my son, Google just gave him like 10,000 computers to try to do some machine learning stuff and see if they can classify a cat. Like they just gave him a bunch of YouTube videos. So like he just has access to YouTube and seeing if the algorithm can like detect cats. And I was just like, what? What is this? What is? Okay, that's odd, but okay. And it's only years later that I find out that it was actually really important work that he was ascribing to me. I knew nothing about machine learning at this point, and yeah, that was actually like a seminal paper that came out because it was an algorithm that but the fact that it was successful was showed that you didn't need to give a computer you didn't need to tell it this is a cat. Here's another video, this is a cat. They just gave it a bunch of videos of all these things and it learned what a cat was. And so that was yeah, it was really cool work and I really should have dug in more at that time to find out more about all this stuff.
Yeah, well, thank you for sharing that as well. And I think that's a note to anyone out there that's working with someone that's doing some really cool work in the field. Like really treasure that time and use it and really push as much as and learn as much as you can.
Yeah.
And were there any big takeaways that you wanted to share from your Masters of Science in Public Health program?
Definitely, build relationships with the people in your program and your professors. In general, that's just a very important lesson you should be aware of that you want to help people, they'll be able to give back to you as well in the future, but you definitely want to invest in relationships. That applies in school and your career and at any point in life.
Absolutely agree with that. And after you graduated, you got into the Applied Public Health Informatics Fellowship at the County of San Diego. So tell us about that experience.
Yeah, so that was a wonderful experience. I had I had so many supportive people around me. There was not just my two official mentors, but there were several others that were basically informal mentors and just equally helpful. And they saw somebody that's doing a fellowship. They're there to learn, and they were just more than willing to provide words of encouragement, teach, correct gently, and just provide a lot of exposure, or even like at the senior levels, providing um, transparency, visibility into some of the things that are going on. A government is huge, and so uh, understanding the dynamics of what's going on, how all these things play into this very massive project. There was a very massive project going on at the time that was like a decade ahead of its time, and it was about integrating public health, social services, and various other agencies, a lot of that data together so that they can do more continuity of care. If someone comes in sick, homeless person or something, they can get referred to public health if they need some testing, to social services if they need greater support. And so that was happening back in 2013, and in my opinion, it went pretty quickly, and I got exposed to a lot of very, very neat projects there, a lot of cool work, very advanced. Thinking about from a business perspective, I got to work with a team that was very business oriented. Also, like one of my mentors was a technology leader in the county, and yeah, and of course my mentors were public health leaders in the county as well. And so it was just a lot of visibility and training and being able to think from like a sort of panoramic perspective of everything that's going on in an agency, how it works the way it does, how to make improvements. And a lot of it, as a probably because of the projects that I was assigned with, but just because of the fellowship. But yeah, a lot of it they showed how much information systems are underpinning a lot of this work.
That sounds like an awesome experience.
Yeah.
Coming out to your master's program and really getting to dig in there, and seems like you also had like a lot of guided mentorship that also supported
Yes.
in your professional development, which I think is really really important as you're coming out of any program, because it's your first foray into maybe like a 9 to 5 type of role in a professional setting many times.
Yeah.
And
I
after, Mhm.
Yeah. Go ahead.
No, you go ahead.
I was just going to add more about AFIF. So yeah, just adding about how supportive they were. I mean, my mentors. would say, we just want to make you happy, right? Whenever we discuss, what I'm going to do, whatever, we just want to make sure you're happy. And they really showed it with their actions. And the other opportunity I had there, it was one day, one of my mentors tells me, hey, there's going to be this Biosense 2.0 meeting. And it's basically a network of people doing syndromic surveillance. That's what his team specialized in. And there's going to be a meeting. Maybe you want to jump on it. And so I jump on, and I'm hearing, this is my first exposure to a community of practice. I start hearing, there's a lot of people in these discussions. There's like a vendor, the C2C vendor for the system. There's CDC. There's, at the time, ISDS was this, International Society for Disease Surveillance, and all the stilts that are participating in this, the state, territorial, local, and tribe jurisdictions participating in this program. And I'm hearing this is the dynamics of the conversation. Essentially, the epidemiologists, the stilt epidemiologists, are saying, "Hey, like we're not sure about the quality of this data, and there's not really any tools available within the system for that." And that's something that they're trying to raise, and I'm sure that on the other side it's trying to be addressed. But as I heard about this, oh yeah, the other issue was that their system, one of the systems within this platform was our Studio server, so that was within this Biosis 2.0 system. And the EPIs at this time, 10 years ago, did not really know R. Their R was not popular back then. It was SAS. I would say it was 99% SAS back then. And now maybe that has decreased to, this is a guess, depending on who you're including, but I would say half, like maybe more 60 or 70% SAS, but there's many, many more R users now. And so essentially these stilled EPIs, which only know SAS, were given in the R system, R to use. And they're like, well, we don't know how to interact with this thing. So, we can't, it's not very useful, right? And so I knew R. And so I voiced, hey, I could write these scripts, these code scripts that'll do such and such and calculate those things. I think I voiced it, and then I put together a plan, like I created a PDF document that said, first we would need to do this. Well, here's the purpose of this project. Here's the problems. It would do this, this, this. It really helped that I had gone in the AFIF program. There was a lot of training from the sponsoring organizations. One of them was the Public Health Informatics Institute, very well known in public health informatics. And I had received training about project management in that. And that was possibly the most important skill that I learned during that year from those trainings, because that is what working with all these people from different states, that's basically what I had to leverage the most. And so I put together what was almost like a project charter. And so I proposed it, and people really liked the vision there. And then I started actually carrying out the project management way of doing things, like with a legit project charter. People need to get it approved. Project requirements gathering, prioritization, meeting with people, being like, okay, we need to make sure we can't do everything, right? We need to prioritize things. So there was a lot in that process, and getting things validated because it's technology tools. And so I carried out this whole basically software development lifecycle during that year. And I did that with, I think there were at least 5 other jurisdictions supporting. And I basically had another mentor in one of the people that was helping with this project, guiding me about how the environment and what people need, just like voicing it, because people are very busy. If I say, can you fill out a survey, they can't always do that, right? Or they don't always have the time to contribute writing anything, right? Contributing to the code, they may not have that time. And so Tarbera was extremely helpful, was a mentor, extremely encouraging, and guiding me through what I should be doing, or just really, she wasn't really telling me like do this or that, but just guiding me and being supportive, like, yes, that providing validation of what I think needs to be done, and that I'm not wasting my time, that I should continue doing these things. And so that was, again, that was all within that county San Diego experience. And and it was cool because it widened my network. I got to work with, really, really incredible EPIs, very experienced. Some started their own consulting companies, but they were throughout the whole country. And my lesson there is that, the that I've seen there and from other things past is that really it's the followers that make the leader, right? Like you don't just go like, oh, I'm gonna be a leader and do all this stuff. Unless you have followers, then you're not really, I don't think you're really having that leadership impact and thought leadership or whatever it is. And so that's something that I keep in mind a lot. I'm very grateful for those that have supported me in those projects. And, I try to either give back, ever since then or still in the future, um, just to help each other out, right? Because like I mentioned, just networks and relationships are extremely important. And so, yeah, that's my just my important key message for people is that, the followers make the leader, and of course that should help also you in tempering any feelings that, is it because you're a leader or you're popular at any moment in time that, you're like a hot shot and, you're like running the show. Like it's not that way. It's really your followers that are giving you that power.
And kudos for you for doing that work, for not only saying, okay, this is the idea and this is what we can do, but creating a PDF document saying this is the objective, these are the problems, these are the steps, and really like your leadership in doing that, because I think many people mightn't get to that stage, and I think you give it credit to the fellowship program for instituting and helping you think through that, which I think is awesome. And as you shared very passionately, it has been very helpful to you in many different regards. And after the county of San Diego, you moved into an epidemiologist position in surveillance at Health and Hospital Corporation of Marion County.
Yeah. So while I was doing that project that I just mentioned, what we called it Biosense USEP, User Community Extension Project, but one of the people contributing to that project was Marcus Rennick. And towards the end of the year, he told me, this is the value of networks. He tells me, hey, I'm going to be, I have this other gig. I'm going to ASTO, Association of State and Territorial Health Officials. So my job's going to be open. And if you're interested in coming over here. And I thought about it. And one of the things that did appeal to me was that, even my mentor, one of my mentors, and, it's really one of my mentors has said like, oh, their boss, the leader there is, this person, Joe Gibson, and he's a really great leader, and I had already seen that because I had been to, was it, yeah, I think that was within the AFIF year, but yes, that there was this huge gathering of all these of all the people in that Biosense program from across the country, and so while I was in AFIF, I went to that, and and Joe Gibson was leading that. And so I saw him at work, and I was like, oh yeah, he seems like a really good leader, very effective. And Marcus is saying that this position is going to be available, and I think the way he said it was like, you've got these skills, and I think you bring a lot of value here. And so I thought about it, and I'm thinking, I want to grow as a leader, and that's really want to focus. And so that's what made me target Marion County, uh, which is where I live now. That's Marion County, Indiana, so Indianapolis, Indiana, and yeah, that's what drew me to this city. And also, my in-laws live a state away in Illinois, or they did, and then now they've moved here. But that was also another motivational factor.
Absolutely, and definitely plays into the importance of that mentorship part and building relationships. And I think like undergirding that is like doing good work, being a good person, so people want to have a relationship with you. And so yeah, that's awesome. And after this epidemiologist role, you shifted into director of public health informatics at Indiana Department of Health.
Oh yeah, so let me quickly mention the other stuff at Marion County. So what I got to do when I was at Marion County was, so I was an epi. I worked again focusing on syndromic surveillance. So any data that comes to, at the time it was really focusing on emergency departments. Any of that data, we would receive it at the health department, and and look for things like, flu is getting worse. At the time, we had Ebola, looking for signals for Ebola and other things, Zika, etc. And that's when I really, in my time in Marion County, is when I really got to spend like half my time in community practice work. And so I led a data quality work group along with Rosa Argos out of Massachusetts. There's a communications work group. I got to lead that one. That was working with ISDS, ASTO, um, CDC even. And that was a very cool project because we had to make a communications plan. There wasn't one for Basins 2.0, but we were able to put it together. And there were lots of things to think about. Like these are all these different communication outlets. What do people need to know? What are they searching for? Where do they go to search for things? How do we make sure we're all in sync? There's a lot to think about there. And so we proposed something. I got approved through the governance group, and there was also a couple other work group efforts that I led, where here again people shared people shared data information about their data quality, like how much for their jurisdiction. This is working with other states and counties. How much what percentage of your syndromic data is missing for your jurisdiction? What percentage of like is it within 24 hours, 48 hours? So timeliness, is the data valid, or is it like are you just sending something that's kind of like garbage? And so all these different measures, and a lot of people volunteered it. It was over 20 different jurisdictions that volunteered that data, which is, in hindsight, it's just like amazing to me. I'm very grateful for that. And I put together a prototype of this thing with a couple of other colleagues, Caleb Wiedemann and Serena Resny. And yeah, we demoed it to NSSP leadership. And that became the kind of like a prototype, a reference that CDC used to when they designed their own data quality dashboard. So now that CDC has their own within the program, but ours was kind of like a proof of concept, and people liked it. Again, we were able to convince CDC that this is valuable. People like this, why it's valuable, and yeah, so they made their own version, which is great. That's I think there's a lesson here, not a lesson here for others, in that don't you create something, don't let your ego be attached to it, that they need to not, you want them just to use that. I've seen that happen since. In this case, it wasn't my like a thing I felt here. I was just like, yeah, it's gonna inspire, basically something else is gonna be useful. And so it was very valuable. So yeah, I had no issue with CDC redoing it with more efficient code, honestly, so it works faster, works better. So that was another great project. I got to work with everybody else, and yeah, just all that community practice work was just so filling for me. Working with people like Howard Burcombe and others, just in general, providing trainings with including not just like my health department, with the state health department, and doing one with the ISDS to everyone that wanted to join that across the country. So there were a lot of great teaching opportunities there for me as well. And that's something that I enjoy. I enjoy learning complex. I enjoy learning things that are, difficult to grasp, and then explaining them in a way that's easily approachable. And I think that's the case for a lot of this data analytics work.
Well, I appreciate you pushing me back to the epidemiology work, because that is definitely some awesome work that you're able to do there, and I love the comment of like don't let your ego get attached to something that you're creating, because I think it's like feel the value and feel appreciated for the work that you have done to lay the foundation for whatever is to come afterwards.
Right.
Is a kind of good framework to think about. So I appreciate you sharing that. And then moving on to your role as Director of Public Health Informatics at the Indiana Department of Health. So how'd you get there? And then what do you do in that role?
Yeah. So that was, I think someone let me know about that. I think the person that had the position let me know, hey, again, same sort of deal. So this is going to be open, if you want to apply for it. And so I got that, and I became built a really good relationship with my boss there, Chris Waldron, and there was exposure to all sorts of things. So at Marion County was the focus was on syndromic surveillance. That was pretty much my only focus there. And then at the state, it was my introduction into electronic lab reporting, case reporting, a little bit of immunizations, thinking about, maternal child health and drug overdose response efforts. And so, and so I got to work with all these different teams, and my focus there was to make better use of again, just in general technology, and just like try to automate. That was my main focus. Try to automate as much as I could. And and so that would be through using R generally. I brought someone back to the org, who was really a Python expert and a machine learning expert, number one. And so I brought them back to try to apply a lot of this machine learning stuff because again, I'm trying to automate things. And so like being able to receive electronic lab reports and figure out where they need to go to. Do we need to send them to the HIV STD program, the hepatitis program? Do we send them to um, HAI, health associated infections, or to enteric diseases or waterborne? So respiratory. So there's all these different programs you need to like send them to the right place for one thing. So that seemed like something that we could pretty easily do, and so that's something that he worked on and he was able to do. Um, but yeah, in general, it was about trying to automate things, trying to. There was also a system migration happening from the old reporting, the old public health reportal condition management system, which was called INES at the time, and they were bringing in the new system, NPS, CDC's system, and going through that migration process, and trying to figure everything out for that. Trying to expand what that system can do because at the time it was not very functional, and we tried to expand what it could do and had people like at least locally figure out they can create better visualizations that are much more flexible because that report in that system, if you run a report from like this day range to that day range, this condition, etc., at these hospitals, you run it and then you're like, oh, actually, let me change the date range. You literally have to start and set the filters all over again. And
Um,
so, and then you actually have to do that for the conditions. Like, I think for each of the conditions, you had to, in some cases, do that. Otherwise, it would just say, if you include a condition that's like, it wouldn't share with you, it's like, oh, it just looks like it was just very difficult to use. It was not user friendly. And so that's why I was trying to work on expanding those capabilities and yeah, just anything that was about, expanding what's these very basic capabilities to make them, just flexible and user friendly, or trying to automate as much of this routine work. I remember when I got there, there was like, they had like a log of things, but there was a log, but there was like, I asked like, what is this used for? And they weren't really sure. And so like, I'm like, okay, well, let's remove things we don't really have a use for and focus on these things that we can like find more value in, bringing in new data feeds, emergency medical service data and poison control data into that system, Essence, and yeah, just working with people to make this migration happen on both sides, like on the organization that's sending it to us and on our side at the health department. So it was a lot of collaborating, a lot of coordination with people, and exposure again to like new program areas and the things that people face within their worlds. And so that was exposure to a lot of things, and yeah, it was very filling.
then you were a data science support unit supervisor at Washington State Department of Health.
Yeah, so then I was looking around and I saw the opportunity for data scientists. Well, no, sorry. I just saw the posting for I saw a posting for a good opportunity at Washington State, and I applied, and with they sent they set an interview date for me, and then they were actually it was like 3 weeks from now, and then they got back to me like 2 days later, said actually are you available like tomorrow? And I was like, what's going on? It's like, did someone just like check like did someone do some research or something? Like what's going on? And when I interview, I find out that, the guy that said to speed it up was somebody who knew about my work in Marion County. And so again, like that whole network thing of like, um, just building relationships. And so I interviewed and I did well. I was and in the when I was being when right before being onboarded, before I made the decision to go, I was basically offered the choice, okay, do you want to do this ECR coordinating thing, electronic case report role, or there's this other one that I wasn't going to necessarily propose because it's so like in the air right now, and it says data science support unit. Basically, we have like all these very complex technical things to do, and moving everything to the cloud and all that. And there's like we might want to do that. We weren't going to do that, but with you, we think you would have the technical skill set, to kind of make that work happen. And I was like, oh yes, I want to do that one. And so that's what I joined to do. And so I hired people, and and yeah, the focus was on moving data from the health agency servers to to Microsoft Azure, their cloud servicer, and also running scripts so that they're more performant. So I meant a lot with all this was during COVID, and so the systems were underperforming, and so we needed to find a way to get information out to people. And so we would take some of the data, copy some of the data from the system, and then try to do the work ourselves using these more powerful computers. Basically, they take it with Microsoft Azure. They'll take a bunch of smaller computers, they'll put them together and to make a more powerful computer called a cluster. But these clusters have their own sets of challenges. They're actually my initial thought going into this was basically from the marketing. It's like, oh, you need 100, like if you need something and you need it to go faster, you just scale it up from like 1 to 10 to 100 computers, and it happens like that much faster. And that turned out not to be the case at all. And so that took me digging into learn more about databases, operating systems, and networking to understand why these things would sometimes fail, what would happen, and a lot of it came down to memory issues. And so that was just a realization of like how much more you need to know about technology to be able to even apply these more advanced technologies. You can't just I think a common perspective is, oh, let's just adopt more advanced technology. And I've heard this from many people, different organizations, and that it turns out to not work. So it's actually very challenging to do that. And that was when I sort of realized also that there's not just the original data analytics stuff that I was teaching that people need to know about. Like now that with all this cloud stuff that was becoming popular and machine learning, that people need to learn about all this stuff, and it's far more complicated. There's a lot more to learn. And I remember something that's an epidemiologist there said, and it was, I really wish I studied more computer science when I was in college, and I think that really reflects the thinking from a lot of people because a lot of people experienced issues with the programs that they were writing. There were so many bugs, things that they didn't know about that would make things fail. And so again, I learned a lot of this to be able to keep up with what we need to do because you need to know the stuff we're going to make good decisions and design good systems. And so that just taught me how there's so much more that people need to learn, and unless you address that gap, all this other work is not really going to get you anywhere, right? Even if you just get a bunch of fancy new tools. So that's and that's what kind of drove my interest more in completing the work that I had started and writing like a data analytics book basically, and just teaching more data analytics, which is closer to what I do now.
Well, I appreciate you sharing that, and I think that that is something that I hear a lot when we talk about like data modernization and things like that. Is yeah, we can give people these big fancy tools, but sometimes that is not the actual need. They need skill sets or understanding on how to use the tools that they have at hand and things like that before we move on to adding more complexities into the work.
Right. And a lot of people don't, I think a big challenge there is like what do they even need to know? There's not even a consensus even now of what they need to know. I jokingly shared once with a group there. Is like I said, oh, to use these more advanced tools, yeah, I mean, you only need to know about like operating systems, networking, and databases like this, ACID, and just all these terms. Oh yeah, processes, threads, blah blah. Very modest, requirements. And they thought that was funny, but it just shows like all these very complicated things come into play to be able to effectively leverage those tools.
Absolutely. And you're a principal consultant at Informatics Innovation, where you're improving human lives by developing the people and systems necessary to effectively leverage digital information and technology. How did you come about going and starting this consulting business that you have, and what do you do?
Yeah, so I I I reached a point where I was feeling that, we weren't addressing root issues like we just talked about. There's the whole workforce development issue, but also doing it in a way um, that's going to be very likely to succeed. And so I had my Delft fam, Diverse Executives Leading in Public Health Scholars. It's a ASTHO and Satcher Health Leadership Institute program. And and that was a fantastic program I did, and met these great people. We just call each other Duff Fam, and we would meet, every month, and just discuss, what we were kind of working through, what we're hoping to do. And in one of those calls, I shared, how I was feeling about the state of things, and then two of them told me just very directly, they said, Harold, I don't, I think the best way that you're going to, ensure that you're doing what you want to do and like going to be happiest doing it is going to be by creating your own job. And I thought about this. Someone else agreed, and just share the same thing. Like just make your own business, and then you can do this and that. And then I heard that, and I kind of agreed with them, but I needed to sit with that longer. And it was, I think, within like 2 weeks that I found out about a contract being offered by a CDC Foundation where they were looking for, a certain to fill a technical advisor role for a project. And I was like, oh, I can maybe do this, and this fits with what I want to do, with some of the things that I want to do. And then I my first thought, and this will sound judgmental and like self-centered, but I just rather be honest about this. My first thoughts when I saw that was, I think, a defense mechanism where I thought like, oh, I'd be a contractor, I'd basically be a vendor. Like, nah, I'm no vendor. Like, I don't want to do that. And that came from just having negative experiences with some vendors, though I learned in the previous things, like in Marion County, like how to form great relationships even with vendors, and so I think it was just a self defense mechanism. And I just thought about it, and I said, no, this is some sort of defense mechanism. You're doing this you're actually fearing not succeeding in this, I think. And you're trying to justify not going for this and risking it. You're trying to justify not taking this really huge, very, very big risk, honestly. And I thought about it. I'm like, no, my friends had just said that this is what I need to do. This is going to be the highest likelihood for me to do the things that I want to do and give me the most freedom to do that. And then I said, okay, that's it. I'm gonna do this. This is like the right time to do this. This is like the perfect opportunity. I agree with all this, what my friends have said. And yeah, again, because of the encouragement from my friends from the Duff program, I it's really what I needed to pass that tipping point to do it. And so I created, like, within a week, I created the I saw that. I took like a day to think about it, like over the weekend, and like planned everything during the weekend. Okay, I need to get a DBA. I need to go like downtown. I do the doing business ads. I need to do that. I need to go SAN.gov, register. I have to accomplish all these things within literally like 10 days. And I did that. It was just like, it was frantic, but I did that and do the application and get like references and all that. And so I did that, and it was like, it was really intense, but and that's why I said it, like, it was a big risk. It was really intense, but I knew that I needed to do it and take that risk. And so I did it, and I ended up getting the award, and I was so excited when I got it. And yeah, and so I've been helping on that project, the working groups project, which I can discuss.
Yeah, yeah, absolutely. But firstly, like, I appreciate you transparently sharing that, because I think those are many thoughts that a lot of us have, especially as we're thinking about what does that transition look like. So shout out to the colleagues that you had at Delft that also pushed you to say, hey, this is what you want to do, as well as the mentors before, like telling you or like thinking through with you, like, if you want to make the impact and do work in your way, like, you really might just have to do something on your own. And then it kind of seemed like the opportunity kind of popped up, kind of what's the word? I don't know what the word is, but naturally from that conversation, it was like, okay, here's the opportunity for you, kind of test that out, and then taking that chance to do it. And shout out to you for also getting the contract as well. And yeah, I would love to hear more about that work.
Yeah, so the project, so I served as technical advisor for this CDC working groups project. And what I really like about that project is that it there was so many organizations at this time, 2023, 2022 at this point, doing, trying to contribute to data modernization initiative. And at the time, there was a perspective, everyone's very, transparent about this, that it seemed to everyone on the ground that everyone's doing things that was kind of overlapping, that it didn't really have direction. There wasn't a unified direction, and that, we need to have a unified direction if we're going to actually, get somewhere and do make any traction, in a short period of time, and be successful, to avoid, the same issues that we were experiencing with COVID-19. And so that was to me. I don't, yeah, I hope I'm sort of representing this project correctly, but to me, that's how I perceive this project. And so that was the premise. And what it would do, the whole intent of the project, is to gather people from, the whole public health data ecosystem. So not simply public health, which is what we tend to do. We tend to just talk to those closest to us. But also, I mentioned there's people in industry that can offer things. There's people in healthcare. They provide the data. There's philanthropy. They provide a lot of resources as well. They convene people, such as the CDC Foundation, um, and, industry, technology, and all sorts of different organizations, sectors. So they can academia, for instance, is another big one. And so they all play a role in this. Academia trains the students. There's a lot of skills from industry, etc. Healthcare provides. So they're all part of the system. And if we're going to have a like national strategy, if we're going to have projects that, again, point in the same direction, that are well coordinated, well orchestrated, if we're going to do that, and succeed, we really need to make sure that these things we work on are things that are viable, seen as viable by all or as many of these different parties as possible. If we just talk within public health of what we should do and don't talk to any of these other people, we're probably going to fail, because we're going to run into something where, somebody else could have said, like, someone from tech, for instance, could have said, like, oh, well, that wouldn't have worked because of this or whatever. For healthcare, would have told her, like, yeah, you can ask for all these things, but we literally cannot send them to you because we have issues with our EHRs. They literally cannot do that. We would have to have new policy at the national level to do that. And so there's all these obstacles we're not aware of, and we need to talk with everybody in order to get that. And I'll just share this one example. It may seem a little remote, but I'll share the relation towards the end. So this is going back to like a story in my biochemistry days, where the teacher had said there is this there's this protein. The way you figure out the 3D shape of a protein um, is by shooting X-rays at it and then seeing where those X-rays reflect and where they end, and then from that infer the positions of all the atoms. And to know the shape is important because the shape tells you a little bit of how it works, and that helps you design drugs, etc. So there was something they couldn't figure out about this. They were like, there's something weird going on here, this spot. And they were like, this is not really possible. And they realized after 3 years later, after studying this, that this thing can only be an atom, and it can only be so close that there's a bond. How on earth could there be a bond over here? And then they ask a chemist, right? Like 3 years later, and the chemists say, they as soon as they tell the chemists say, well, yeah, of course, iodine can catalyze a reaction, catalyze this bond between these things. And and that just shows, like, biochemists talking about themselves. It took them 3 years to figure out something. If they would have just asked, like, a good chemist, they would have learned. The right chemist, they would have learned immediately, saving themselves 3 years, right? And I think that's really the same sort of thing that's happening in public health and in public health data modernization, where there's people out there that kind of know what we should do. They have a piece of the picture, but you need to get them together so that you can form this picture together. Otherwise, you're kind of, just going kind of circles, or really just learning from failures on your own, kind of slowing things down that way. And that's why I think that project is so important. And I think it was very successful. And if people want to learn more about that project, they can Google CDC Foundation Data Modernization Initiative, and there they'll find a page, and they can go to the bottom of that page, and it'll point them to the Health Data Innovation Summit series. And this is where they can basically hold conferences with different hundreds of different organizations, and got their perspective, shared what the problems are, what's needed, what people think needs to happen, and we're just very open, sharing their ideas and solutions with each other, so that it's as visible as possible. And I believe that's why they're making all those presentations public as well as slides.
That really just highlights the importance of like the multidisciplinary approach in public health, and like to your point, it's like we look at issues from our one perspective and our one lens of expertise, but sometimes it might take looking at an issue from a different angle and a different perspective to really bring the full understanding. And I feel like there's some sort of analogy around the elephant, and like seeing the different parts of the elephant or touching the different parts of the
Yeah,
elephant, but not seeing the whole picture. But I think that really does highlight that. So I really do appreciate that perspective.
no problem.
Yeah. And before we move on to the Furious Five, I wanted to ask, because you're doing this consulting work now. You've spoken about how you built a lot of this expertise and the skill to do the work that you're doing, but consulting is also like business contracts, accounts receivable, all those kinds of things. How did you go about building that skill set or leveraging other people?
At least let me start, like, when I applied. For one thing, I was going to submit this application to this RFP. I had submitted one. I did most of it on my own before for the Biosense thing for an SSP, and we in my organization received that. But this one just seemed a little scary because it was directly. I was directly doing this, going to do this all on my own. And so here I reached out to some friends that I had at Marion County that I haven't seen in years, but I reached out to. They were the grants people that I was very we were very friendly with each other. And so I reached out and I said, "Hey, I'm applying to this grant, and I was wondering if you can give me some advice on this stuff." So again, the networking thing is like extremely important, and and so they helped me with that, and contributed to a lot to me, being awarded this contract. Um, so after, have it, getting organized, I talked with someone from CPA department. And I think if you Google that, that's its own organization. And I think they specialize in nonprofit consulting. Yeah, nonprofit finance consult, governmental contracting consulting. And I had, a meeting with them and they explained a lot of things to me about like taxes. I think that was just my biggest worry, honestly, when I started. It was like, how do I do this tax stuff? I have no idea how to do this. And, they answered a lot of those questions for me. And from there, it was really just a matter of, getting organized on what I need to keep track of every month, and how just knowing what's tax deductible and all that. I filed my last thing with IRS. It may seem like a little like it may seem like a boring thing that's not important, but these things are really important, as you probably know. And
Mhm.
so that, yeah, like I said, that was one of the more stressful things for me because I have no expertise in finance or accounting. And yeah, and so far the IRS hasn't come wanted their money back, so I assume that I did it right. And yeah, that's really the biggest thing. I think yeah, I don't know. I think other traits were just little things I had heard from my coach, my professional coach, when I was in the Delft program. He had given me some words of advice when I told him that's what I was going to start. And that's I think that's really about it. But now, yeah, I just formed the LLC, and feel very comfortable navigating this space. And I'll just say, for those listening, I didn't think this would be the case, like 3 years ago. But once you set up an organization and you're like confident that you did it right and all that, I think you start to see that you can do a lot more than you may think you're capable of. Like, you realize, oh, you can actually start your own nonprofit. You can do all these things and contribute to creating your own way and creating your own career. And so I think that's just a quick thing I want to share with people.
Absolutely. And before moving on to the Furious Five, where can people connect with you, and where would you like to see yourself in the future?
If they want to connect on LinkedIn, feel free. If you want to email me as well, yeah, we can find some time to chat. Where I see myself in the future, a little longer future, I think one of the things I'm going to be doing now is going to be teaching a data analytics course. I'm going to have a cloud and AI course as well. And I want to have those on a website so that it's available to anybody in the world. And that again, like, because my focus has been on workforce development and on teaching, advancing technology use in public health, just having that out there. And honestly, even with outside of public health, just like I said, these skills are helpful no matter what, like, specific domain you work in. So I think ultimately that's like a middle range sort of goal that I like to have. And then if I have if I'm successful with that and have a lot of free time doing more volunteering and doing other projects, maybe getting back into global health or something, uh, would be would be a nice thing to do, and learning more.
Well, thank you for sharing that. When you do build out that website, feel free to share with me so I can share with everyone else.
Awesome.
But good luck on the future endeavors.
Thank you.
You're most welcome. So, moving on to the Furious Five, the five questions I ask all guests. So, number one, what advice would you give to a student trying to pursue a career in public health?
Mm. I would tell them that public health is huge as they'll find, and to find something that you're really that where you have a lot of skills, where you enjoy things, and you'll probably be able to find your own little slice that you enjoy. There's also, I think, everything in a way sort of is overlapping with public health. Just being able to live a good life, and so feel free to just navigate the space, talk to people, like I said, to either in public health or yeah, in public health, and your professors, just to get a sense of like, is this really uh, a right career for me? doing research, but talking to people more just to get their lived experience. Like there's a lot more behind than just the numbers, right? And so getting their perspectives on talking to them about what your long-term goals are and if how this can fit into your route, if that's what you want to pursue, um, that maybe take that approach.
Number 2, if you're talking to someone wanting to get into your position, what advice would you give them?
I would say learn if you're trying to get into the data analytics like subfield within public health, I think you definitely want to learn about coding. And like I mentioned, the R for data science resource is good for you. There's being in consulting now, I think, yeah, one of the things I learned is communication is so important, communication skills. And so that's just as important as your technical skills, as your knowledge, because especially if you're consulting, you're working with high level leadership a lot of times. And you want to make sure that you're very clear and succinct and very direct almost in what you're saying. And so that's something that's a little harder for me. And maybe that's why I'm pointing that out, but that's the communication skill is going to be extremely important for you, especially if you're in consulting.
Number 3, what's something you're working on improving in your life right now?
Right now, I'm working on becoming healthier. So I'm trying to lose quite a bit of weight and doing it through the exercise and walking and just shedding off all those cookies from COVID period. And that's it. That's I know also that when that I shared before, when you're healthy, you perform better. It's a lot of discipline that goes into it. When you go through that whole process, a lot of things become much easier in comparison. And so that's my focus right now is on becoming healthier.
Number 4, professionally, do you recommend anything?
Yes, I recommend pretty much anybody to read the book Difficult Conversations. And it's Difficult Conversations. I think it's how to have the difficult how to have important conversations that matter or something like that. Oh yeah, how to discuss what matters most. So
Okay.
difficult conversations, how to discuss what matters most. I think that's a very important tool for people to learn because there's always going to be conflict in any environment. And yeah, just knowing about how to remove yourself and your ego from the situation, that's going to just save you a lot of time, make you feel safer, make you more comfortable with broaching the topics that are important for you to advance the dialogue.
And then, last but not least, if there was one piece of advice you'd give to your younger self, what would it be?
I would say keep doing what you're doing and it'll work out. Very simple, but I think that's really all I can think of.
Love it. Love it. Well, Harold, thank you so much for coming on and sharing so much information. I have so many notes and so many resources that are going to be shared in the show notes page. So people definitely go across there and check out all the links and the wealth of information that Harold shared. But thank you once again for your time and your expertise.
Thanks, Amari. Have a good one.
Yeah. Housekeeping items, everyone. Thank you all so much for watching or listening to this. Be sure to subscribe if you have not as yet, leave a review, and share it with a friend. Greatly appreciate you all, and see you all next week.